In this video, I'm going to demonstrate dry needling to the gastocnemius and soleus muscles in the generalised calf area of the lower leg. This is a really useful technique for clients that might be suffering with generalised calf pain or cramping on physical activity, or even cramping when they're sitting for long periods of time. It's also useful for clients that might be suffering with Achilles tendon strain or plantar fasciitis in the bottom of the foot, because both Achilles tendon strain and plantar fasciitis can sometimes be caused because of tension in the gastocnemius and soleus muscles, which then come into the Achilles. And as we know, the Achilles then attaches into the calcaneus at the bottom of the foot. Okay, so we're just going to open up the area here that we're going to needle. So with dry needling, we're essentially identifying through palpation areas of hypertonic tissue, tension or trigger points as well. So we can develop trigger points in any part of the muscle, but commonly, if we look at a trigger point chart, we've often got common trigger points as well, which most people might develop near muscular junctions. When it comes to the gastocnemius muscle, the larger of the two lower leg muscles, we might often find that our clients have tension in this lateral head, and we might also find that this common trigger point, which sits just between the two heads of the gastocnemius, might also be quite active. When it comes to the soleus, again, we'll commonly find a trigger point sort of roughly in the middle of the soleus, and again in the heads, the medial and the lateral heads, which come underneath the gastocnemius muscle as well. Okay, so we're just going to palpate Katie's calf area, her gastocnemius and her soleus, to feel for that tension, and it's through palpation that's going to identify where we're going to place those needles. So through palpation, I can identify that Katie's got a nice trigger point just here, and she's also got an area of tension on that lateral head here too. Also, we can feel that Katie's got tension in her soleus just here. So this is where I'm going to place the needles. So for the purposes of today and the size of Katie's muscle tissue, I'm going to use 25 millimetre needles. Okay, so I'm just sterilising the area first with a little bit of antibac. You can use sterile wipes as well if you prefer to in your clinic. So remember, you're going to sterilise your hands and also clean the area that you're going to treat. Okay, so these are our 25 millimetre needles, okay, and these are Classic Plus needles. So they've got a stopper at the top there. So I'm just opening them up. These are guided needles that I'm using. Okay, so we know that they're sterile and they're guided with the tube. So I'm going to come for this common trigger point first. So I'm going to place the needle into the common trigger point first. So I've taken the stopper off the needle, and then from here, I'm going using that perpendicular action. Okay, I can see that the needle is sticking out of the top of the tube there, so I'm just going to gently press the needle in. We don't need to do any firm knocks with the needle with most of our clients, and then from here I'm going to press down roughly about halfway, and now the needle is inserted into that common trigger point. I'm going to do all of the needles first before we activate the needles. So I'm now coming down to soleus using that same technique. Okay, and pressing that needle in and then pushing the needle down roughly about half the length of the needle. And then I'm going to place two needles onto the lateral part of the tissue. In this one, I know that through palpation I can identify that Katie has a line of tension. So I'm going to angle my needle and go in a more longitudinal direction, more longitudinal through the length of those muscle fibres. And then our final needle for this area today, coming slightly lower where Katie again still has a line of tension, and placing that needle in. So all of the needles are in nice and securely. I'm looking at the tissue here. Quite often we might see erythema coming off the needles, and that's going to tell us that we've increased the localized blood flow to the area of the tissue. And that's great for the healing process, because we know that when we increase that localized blood flow, that brings nutrients and oxygen into the tissue. Okay, then first activation method that I'm going to use, just so that Katie starts to experience some sensation from the needle, okay, is the flicking method. Literally with the back of the nail, we're going to flick the needle there, and that will send a vibration down the needle into the tissue. So we've flicked all of those. Do you feel anything coming off any of those needles, Katie?
Slightly.
Okay. If our client didn't feel anything at this stage, then what we could do is our turning method as well. So we're just turning that needle slightly in order to wind some of that fascia up and increase that sensation around the area. And the final technique that we're going to do here is our peppering technique. And sometimes that's great for helping to stimulate a twitch response. And we know if we stimulate a twitch response in the tissue, that leads to rapid depolarization in those muscle fibers. So I'm going to start with this one, which is over that common trigger point area. And I'm just literally moving that needle up and down. I'm holding onto Katie's leg here, just in case she gets a strong twitch, because often if the client gets a strong twitch, she might jump. Okay, how are they feeling?
Yeah, I feel more.
Okay, and the last two, just peppering those needles. And although we've got 4 needles in the calf region, this is going to help to stimulate a relaxation effect in all of the area. So this is our dry needling technique, inserting the needle into gastocnemius and the soleus area of the calf region. Useful, as I mentioned, for cramping techniques, but also for reducing hypertonicity in the muscle tissue, especially helping with conditions such as Achilles tendonitis or Achilles tendon strain and plantar fasciitis as well, which may have resulted because of tension in this calf area. And the stimulation techniques that we did was the flicking technique, the turning technique, and the peppering technique too.